Today's episode is going to be about postpartum recovery, fitness, and care. Lifting weights is not mandatory during pregnancy. You can choose yoga, you can choose walking, you can choose Pilates, you can choose anything that you enjoy. Now, you may have a vaginal delivery or you may have abdominal delivery. Both have a certain recovery time. Women who've had vaginal delivery sometimes just heal faster. But in case of abdominal delivery, remember you've cut through everything to pull the baby out. One of the questions that I often get asked is, why did I have an abdominal delivery? My cervix would not dilate. It was actually a near-death experience, and my doctor was like, all right, my YouTube family, thank you for being here, listening, sharing. Now, today's episode is going to be about postpartum recovery, fitness, and care. And this is a part of our postpartum series that we are doing. But before I get into postpartum recovery and fitness, I want to briefly talk about my journey, because when I spoke about this on social media, on Instagram, a lot of them were curious and had a lot of questions about late pregnancy and delivery and all of that. So I'll quickly go through my journey before we start about postpartum fitness and health. All right. One of the questions that I often get asked is, why did I have a child so late in my life? Or did I have some health concerns? Did I freeze my eggs? Was it hard? No, I did not freeze my eggs. No, it wasn't hard. That's probably not the answer, you were looking for. But honestly, touch wood, God's grace, my effort in my health, it's been fairly smooth. Having said that, I prioritized my work throughout my 30s. There's this one time when I had a very, very bad dengue attack, and it was actually a near-death experience. And when I lay in the hospital, I questioned my life choices, and I was like, okay, there's so many things that I probably wanted to do in my life, which I thought about in my 20s, and I haven't. And one of the key things was have a baby. I actually wanted 3, but now I've settled for 1 because it's too late. But then it was about changing my husband's mind, because he was like, no, we cannot. It's too late. We can't change our lives. Everything is going to, go topsy-turvy. Long story short, we discussed, we convinced, we moved ahead with the decision, right? Now, when you've made up your mind that you want to have a child, right? Then the next question is, when you decided that you want to have a baby and you're very sure about it, what are the few things that you need to test for before you even start the process? Because what I have seen is most often people just keep trying, like couples keep trying, and sometimes it doesn't convert to anything and you get frustrated. But instead of that, you first do the tests needed to identify if you're in a good space to be conceiving, you're at a health level, at a sperm level, at an egg quality level, all of those things, right? So you do certain amount of tests for the woman and certain amount of tests for the men. Now, for me, of course, I did my blood panel, I did my hormone panel. But the most important thing for us as women is we need to track our cycle. We need to know our ovulation. We need to know, our number of days of the cycle. So menstrual cycle needs to be jotted down very, very clearly. That makes it very easy. Identify your fertility levels. And then, of course, the hormone panel tests and the blood work will give you all the other information. For men, it's super duper important to do the semen analysis, or also called the sperm analysis. Along with that, you also need to do the hormone panel for men and your regular blood work. Once you've done your tests and you have your report and you think everything is clear, you can still go and show it to a physician or your gynecologist and go ahead and start trying conception. Or you do further intervention to first fix those little, things that you need to fix in your report, and then move ahead planning conception. Don't blindly go straight into trying to conceive without understanding what's actually happening inside your body. So that's the first thing we did. And when we knew that we were in a great place, there's nothing really to work on, we went on a holiday, and the next thing you know, I was already pregnant. Yeah, I had conceived, or we had conceived, right? So it was fairly smooth. And I honestly attribute all of this to good health and consistent exercise, good eating, all of those things, right? Because again, I keep getting asked, how was it so easy at 39? you didn't freeze your eggs, you didn't do any of that, and it was so easy to conceive. I'm not saying it's going to be the same for everybody. I'm not saying it's going to be easy for everyone. Each of us, our bodies are different, our partners' bodies are different. So it's not as simple as I'm making it sound, also, honestly. But for me, it was simple, and that's the message I also want to put across, right? Now, prenatal or pregnancy, what did that look like? This again is going to be so different for every woman, okay? Whether you're 25 or 35 or 40, it can be hard, it can be not so hard, it can be easy. And I can safely tell you at 39, I had good 9 months of pregnancy. I literally can't remember a day that was painful. I don't remember a day of nausea. I didn't have any sort of gestational diabetes or, okay, my thyroid levels were fluctuating a little bit. I was on some medication, but overall, my 9 months were a breeze. I ate well, I slept well. In my training, the first 3 months, I took it quite easy. I did a lot of light and moderate training, but from my second trimester onwards, I went back to normal, where I lifted weights, I did cardio through dance fitness, and I walked a lot and did a lot of household chores. I was in control of my body. I knew what I was doing, so it was easy. But if you do not know, what to do, your workout and all of that, I would always recommend, please do it with a qualified coach or a trainer, a prenatal, postnatal trainer. Also, with lifting weights is not mandatory during pregnancy. It's something I've been doing all my life, so I continue doing it. You can choose yoga, you can choose walking, you can choose Pilates, you can choose anything that you enjoy. The bottom line is movement, right? So even if you don't want to do anything and you simply walk a lot, fair enough. That's also a great start, or it's a good way to just be active, right? So I did all of it, and it was quite peaceful. Like I said, I didn't have any issues. Towards the 9th month, of course, I started taking it a little bit easier. Didn't push myself as hard, although I had the energy and everything. I didn't push myself too hard. Now, if you have complications though during your pregnancy, then please don't take on any physical activity. Talk to your gynec or your prenatal coach and accordingly manage it. I did not have any complications, which is why I went the whole way, right? Now, talking about delivery day. Okay, so here again, I get a lot of questions on what delivery did you have, normal, C-section. First of all, I don't call it C-section or normal delivery. Any sort of delivery is a regular normal delivery. So the right term to use is abdominal delivery and vaginal delivery. Now, why did I have an abdominal delivery? My cervix would not dilate, right? I had crossed 40 weeks. I had full 40 weeks of pregnancy. I had crossed 40 weeks. And my doctor was like, okay, looks like the cervix is going to be a little difficult to dilate in my case. And it could be my age, right? It could be so many factors. I didn't do any inducing or induction because from my doctor's knowledge, she was like, in my 40 years of experience, this doesn't look like it's going to dilate. Having said that, if you want, you can do it. I chose not to because we were in the peak of COVID and hospital was the last place I wanted to be, but I had to be there. So my choice was abdominal delivery, and I wanted to get out of the hospital in like 1.5, 2 days. And that's just what we did. Delivery was peaceful. I got back home with our tiny little girl in under 2 days. And then starts the postpartum journey, right? Again, no two women necessarily have to have the same delivery experience, right? Some of us go through it the hard way, whether it was abdominal or vaginal. Some of us have it fairly easy. I think mine was smooth, and I have zero complaints about my whole experience. Everything was great. Now, talking about postpartum, which is what the crux of this episode is going to be, right? The phase postpartum is actually your 4th trimester, all right? So the next 12 weeks is really critical for your mind, for your body, for you to just adapt to everything, right? But remember, the 12 weeks rather, okay, is your 4th trimester. But I personally tell everybody that your postpartum phase doesn't end there, right? Your body can take up to 12 months to heal, and that is normal. Just like your conception journey, your pregnancy journey, your delivery journey, your postpartum is very personal to you. Okay, I had it a certain way. You will have it a certain way. Listen to others' journeys, understand, but never expect the same journey for yourself. You need to figure out what works for you, and that you will over a period of your journey, right? So, the first 12 weeks, like I said, your fourth trimester is very, very precious. All you need to do is work on just understanding what your body is going through, understanding what your mind is going through, and understanding the little human that you just placed into this world, right? The pregnancy journey, right? It's physiologically demanding transformation, okay? Now, there's so much that your body has done, or so much adaptation had to happen for you to grow and nourish and take care of this human inside your body, right? So don't expect a miraculous recovery or a quick recovery. That's not how it was planned ever. Firstly, your body had to switch on, the hormone system. That's like your master switch for every woman, right? The hormone system. So your hormones are all over the place, and the way you're going to feel physically, mentally, emotionally is going to depend purely on those hormones, right? Secondly, the cardiovascular system. It's actually working overtime. More blood flow, more cardiac output, higher heart rate, right? And sometimes you'll see in the first, like you feel nausea and dizziness is also sometimes because your BP is fluctuating. The body's just trying to figure everything. So there is your cardiovascular system, which is also overworking. Then you have the musculoskeletal system. You'll see that as your belly is getting bigger, the center of gravity shifts forward, right? Your hip starts widening. There are so many changes that happen to the body, and your overall joint stability also reduces because of hormones, right? So the whole skeletal system changes shape. And sometimes those wide hips barely even go back to how it was pre-baby. Like for me, I feel like my hips have actually widened, and they've not gone back to my original, which is okay. So the musculoskeletal system changes. Then you have your pelvic floor and core. Oh my God, the main part, the crux of it. Now, as your uterus starts growing, because the baby is growing, uterus is carrying it, right? The uterus moves from a pear shape to a large watermelon shape. So imagine your uterus is pushing through those abdominal wall, thinning and widening that connective tissue, right? That causes something called the abdomen separation, or also known as diastasis recti, which we will talk about a little later, right? And then your pelvic floor. The name suggests it. Your pelvic floor is what is carrying that large watermelon or that big uterus. So the pelvic floor also starts feeling like there's a lot of load on it, which is why we say that after you birth, you need to strengthen that pelvic floor, right? It's like the floor of your house. There's only certain weight it can carry. It's like a lift. There's only a certain weight a lift can carry. So your pelvic floor also starts looking weak after delivery, which you need to strengthen. So the pelvic floor and core has gone through a lot. Then your respiratory system, your immune system, your metabolic system, everything in the body is changing and working together like a machine to grow that human in your body, right? And we also call our nervous system also is working harder, right? The pregnancy brain. Now that pregnancy brain, you always think is like a decline. Oh my God, I'm forgetting this and forgetting that. It's actually your brain, just like the neural reorganization happening in your brain, to basically become more emotional. You're just becoming more sensitive about things around. It's just your emotions rewiring because you have this human growing inside you, right? It's beautiful. Taking a quick break to thank our sponsor, Philips Avent, the breast pump I think every new mom must have. Well, it's just so much more convenient with something so small, comfortable, 3x faster, and 2x lighter in weight, right? Just making life comfortable for us to pump whenever we want to. I also used Philips breast pump, but then of course it wasn't this smart. It was a different version. But thank you, Philips. Apart from all of this, and apart from a new human inside your body, you're actually growing a new organ in your body, the placenta, which is used to feed your baby. So just imagine what this body has gone through this pregnancy while you're trying to grow a new human, right? It sounds so magical. It is very, very beautiful. So you need to treat this body with a lot of love and respect postpartum. And the same thing we say before pregnancy also. If you don't give your body enough care before having the child, you are going to have it difficult. But if you've taken great care of that body before trying to conceive, you may just have it a little easier, right? So keep that in mind. All right. So now we're in the fourth trimester. Your hormones are all rebalancing. The uterus is going to start shrinking back to its original size, going back to its pear shape. The pelvic floor, we need to work on making it stronger again. The core needs to connect back. You got to start feeling your core again. Now, all of this is a whole lot of work. Along with this, you need to care for the new human being, right? And the sleep deprivation. So, for all my new moms or to-be moms, remember, your postpartum journey is not something that gets over in 12 weeks. It's going to be a longish process. It's going to be different for different mothers. Just embrace it. Seek all the help you need. Use a qualified coach, a certified nutritionist, etc., to bring everything together and to take care of this beautiful body and your mind that has done so much, right? Now, talking about recovery and getting back to fitness. I have so many people asking me, how do I start? Where do I start? What do I do? What do I do with my diastasis recti? What do I do with my umbilical hernia? So on and so forth, right? First, let's understand. Now, you may have a vaginal delivery or you may have a abdominal delivery. Now, both these have a certain recovery time, in the sense women who've had vaginal delivery sometimes just heal faster, okay? Like everything, if you don't have prolapse, if you don't have any perineum issues, then you will heal faster, but you still take 12 weeks. But in case of abdominal delivery, remember, you've cut through layers, okay? There's fascia, there's fat, there's muscle, and uterus. You've cut through everything to pull the baby out. So you need to be more cautious when you start back on your fitness. First, you need to wait, because you have to feel your deep core, right? Wait for the scar tissue mobilization to happen. Wait for you to start feeling less pain around this area. There will be numbness for a long time, but you don't want to start when there is still pain. Now, scar tissue mobilization of the scar itself, nobody talks about, right? Not even your doctor. But you need to start mobilizing that scar, and there are enough information and videos about it online, using your fingers, okay? And using maybe coconut oil or ghee, or could be some cream as well. If you don't mobilize your scar tissue, then you will see a thick layer of skin starting to form over it, and that becomes pretty much permanent, right? Like a keloid. So, like any other scar coming from a surgery, you need to do scar tissue mobilization first, right? And then you wait for the pain to subside. The numbness will be there for a long time, right? And then you slowly start. Now, before we actually kickstart the workout, the first 6 weeks, okay, is very, very critical. These 6 weeks, you need to focus on a lot of breath work, okay, deep diaphragmatic breathing, so that you can start feeling that core again, because your core has gone through a tornado, right? Pelvic floor connection, right? You need to feel that pelvic floor again, where we do Kegels and a bunch of other exercises. So first is diaphragmatic breathing, a lot of breath work, and then start doing some gentle walking. Just start moving so that you allow for a lot of blood circulation to happen, and some very light mobility work, okay? We also say that while you're in bed, you can do some movements like hip bridges, because your posterior strength is really deteriorated, and your glutes particularly. So once you start activating with hip bridges and stuff, you can actually start feeling your glutes again. All of this will be provided in a cheat sheet. Please don't worry. But the first 6 weeks, slow, almost nothing, but a little bit of gentle walking, a lot of breathing to start feeling your core again. Okay? No crunches, no planks, no running, no jumping, nothing, even if you feel like $1,000,000. No, do not. All right? Then, after 6 weeks, typically what we do is we go to a gynec, they check us up, and they say, okay, you're good to go. You can just go, do whatever you want. But no, you cannot do whatever you want, because now is that time where you've got a clearance from the gynec. But the truth is, the gynec hasn't checked your diastasis recti. The gynec hasn't asked you if you have incontinence, if you're peeing when you're coughing or sneezing. No, right? Maybe some do, but not all do. So before you can actually actively start incorporating any exercise, any, mind you, okay? It could be yoga, it could be Pilates, it could be running, it could be strength training, dancing, nothing, right? You need to see a pelvic floor specialist. If you don't find a pelvic floor specialist, see a physiotherapist, right? I went to a physiotherapist because I had easy access to one, but there are good pelvic floor therapists as well. You just have to look for them. They will identify if you have a diastasis recti, which is an abdomen separation, which is normal for everyone to go through. Some of us automatically close after some point. Some of us have it open for a longer duration if not treated. And then also get the physiotherapist or pelvic floor specialist to check your pelvic floor. How weak, how strong. Strong is not the right word, because all of us need to strengthen the pelvic floor after what we've gone through, right? But if you have incontinence, urinary leak, okay, that means it's very weak. Then you have to do the right kind of exercises, maybe with the physio, maybe with the pelvic floor specialist, or maybe with the postnatal coach to strengthen that pelvic floor again. Or there could be organ prolapse, or there could be rib flare. There are so many conditions that can happen which can go unnoticed. So it is mandatory that after your gynec check, you next go to a physio or a pelvic floor specialist. Please don't skip this order, no matter how fit you think you are, because even I didn't. I mean, I've been working out for over a decade now, but I did not skip this part, right? Now, once you've seen and once you've got the clearance, now the clearance could be that, hey, you're all good, you can slowly build back, or hey, you're not fully good and you need to train with me or train with a specialist, whatever. That is something that you will decide. But the first and foremost thing we fix is our core. Everybody, whether you have issues or don't have issues, the first thing you fix is your deep core. I remember the only time in my life that I actually didn't feel my core, where I couldn't sit down and stand without falling, was postpartum. And that's when I understood the importance of a strong core. Like, I'm sure if you are a mother already, you know it. But to my new moms to be or new moms, when you're sitting down without support, you will not be able to sit down. And when you're getting up without support, you cannot get up. That is a problem of the core, right? So first is finding the core, activating the core, connecting with the core, bringing back the abdomen together. That work is very, very critical, strengthening the pelvic floor. Now, as I said earlier, your posterior chain has gone through a dramatic, I wouldn't say change, but it is weakened, okay, because of that tilt or the shift forward with the belly becoming bigger and stuff like that. Your lower back, your glutes, the strength of all of that, your upper back, everything deteriorates, okay? There's some amount of even maybe your muscle reduction can also happen in these areas, because I noticed it happened to me around my glutes. So first, after you work on your core and pelvic floor strength, work on posterior chain strength, right? Work on your strengthening your back, which is also a part of the core, but your upper back, because you're going to be feeding and you're like that, and then focus on glutes, right? Focus on your posterior chain. So you can take about 12 weeks or even 4-5 months just working on the core, okay? Just working on posterior chain, just working on building back the strength. Do not, or please don't, think about, I need to lose weight, I need to get back to my pre-baby weight and things like that yet, because it does not matter. It does not matter. I remember taking a whole year before I actually bounced back to my pre-baby weight almost. I've never been at the pre-baby weight at all, but I'm okay with that because I've gained more strength. I've become stronger postpartum than I was before, and I think that just makes me happy. Some of us bounce back, some of us don't. Each body is different, and you need to start respecting that, right? Once you have built strength in the core, once you feel the connection, once you feel I do not have any incontinence or pelvic floor issues, right? Then you take your training up, and this process can even take up to 6 months. It's okay, right? Then you push it up a notch. Go find yourself a good place to work out, a good coach, all of those things. And then you can probably even start the journey of fat loss if you feel like you're ready for it. Again, each of us have different journeys. So some of us have started on a fat loss journey after 2 years postpartum. Some of us after 3. Some of us after 6 months. So you just do what works for you, but don't rush this process, right? This is the most sacred moment of them all, according to me. So don't rush it at all. Now talking about specifics, right? If you have DR, a lot of questions for me about diastasis recti or abdomen separation is about, can I fix it? You 100% can fix it, okay? It may not fully close, but you may have like 1.5 finger gap, which is not a big deal at all. So sometimes that belly or that pooch that we talk about, mummy pooch that we talk about, could just be your DR and not necessarily that you've lost weight everywhere but the tummy. I have a diastasis recti, which I've covered almost not 100%. I have an umbilical hernia, which happened to me before pregnancy, but continues to be there, but doesn't bother me because I've learned how to work with my core without troubling it more. Now, when you have an umbilical hernia, if it starts hurting, you need intervention. But if you know how to brace your core well, breathe the right way, then you may not need intervention on that umbilical hernia at all unless it gets worse, right? And with the DR, like I said, it's fully fixable. But diastasis recti and umbilical hernia are different things, so don't confuse one with the other, all right? Then, pelvic floor, incontinence, all of that can be fixed. Rib flare can be fixed. Organ prolapse can be fixed. Everything that comes with postpartum is fixable. Don't worry. Just need to have patience and have the right support and the right coach. Last but not least, weight loss or fat loss. Now, when you start this journey, remember, it's just the good old simple techniques. You need to be on some amount of deficit, calorie deficit, so you have to have a perfect good nutrition plan. You still need to walk often or daily or regularly as much as you can. A lot of the household chores that you do, the stuff that you do for your child will matter. The neat activities, right? The non-exercise activities will matter, and consistent exercise will matter. What you cannot control is your sleep, because we all know that we will be quite sleep deprived at least for the first 3 years, right? That's like, I'm hoping that's the max for everybody. So when your sleep isn't perfect, fat loss also becomes slightly harder, right? So don't beat yourself up over the fact that I'm so consistent with my workout, I'm eating quite right, why do I still not see a drop? It just may slow down a bit, but trust me, it will happen. So don't rush the process, don't do anything crash, because that's only going to bounce back and going to be counterproductive, right? But losing fat, losing belly fat, all of this is possible, done the right way and done the sustainable way, okay? So you can fix your DR, you can fix your prolapse, you can fix any issues, you can fix your weight, but all in time. Just don't rush. First and the most important is identifying that there are these issues and not assuming that I don't have it and not assuming that it's okay. Because when I speak to a lot of new moms, and when they tell me after a few sessions that, oh, I do have a little bit leak that happens when I jump, right? This is information you need to give, your coach or your physiotherapist or your specialist right at the beginning, right? Because it can only worsen with exercise sometimes. If we don't know and we're trying to train you a certain way, and then if you don't know about the condition, we can make it worse. So it's very important that you first get a clearance from the right people before you start working out, and the weight loss will happen, right? That was really about my journey, but that was also about how you need to treat your journey on postpartum. We are going to put a cheat sheet. I'm going to try and put the exercises that you can do between those 0 to 6 weeks and 6 to 12, what you can do at home, what you can do around your baby. But more than that, I also need to tell you that we have our postpartum fitness program, the core and pelvic floor rehab and strength program, that's going to launch on our Health Edit webpage real soon, which means you can just go on the website, purchase the program, and start doing this wherever you are and at absolutely any point. You may not have done anything for 1 year or 2 years after the baby, but you still need to start from scratch. Please remember that. So you still can access the program, start from scratch, and then go do whatever kind of physical activity it is that you want to do, right? So remember, your body is beautiful. Your body has just done a miraculous activity. Respect it for what it's done. Show the body and mind a lot of love. Show yourself a lot of love. Enjoy the process, because this journey is going to also be over. Just like your pregnancy, 9 months is over, this postpartum journey is also going to be over. Do not be in a rush. Make it personal to you so that you can talk about your journey being so different from somebody else's. And it can be hard, it can be a little easy. Fortunately for me, it's been easy, but I'm still working with certain things that I haven't bounced back to, and that's okay, right? The end goal is for all of us women to just become stronger, right? Yes, we want to look a certain way. I'm with you and I also feel you, but the end goal should always be to be strong, to be able to just play with our kids as long as we can, to be strong even in our mind, to allow our brain to feel good as we age, because there is going to be a lot of deterioration. Yeah, and just have a lot of energy to be able to do everything that we want to do. So that should be your ultimate goal, all right? Everything else will come and go. But everything is possible, mama, okay? And you got this, and we're here to help you. Thank you for listening. Please share and watch out for our postpartum program coming on the Health Edits soon. Thank you.